Across Sydney, tens of thousands of people are isolating in their homes as positive COVID cases or close contacts.
This is the first week we're out.
Last month, Rana El Halou became one of them after her son tested positive for COVID. After 24 hours, she and her remaining children had also tested positive. Under state health regulations, the whole family had to isolate at home for 14 days until it could be independently confirmed they were no longer infectious.
I stayed in isolation 29 days. And I was calling, I grabbed numbers from internet from everywhere.
Breaching the stay-at-home order carries the risk of an $11,000 fine. But with case numbers in Sydney continuing to rise, contact tracers are struggling to keep up with demand.
Every day I called this number they gave me. Give me your name, your date of birth, your email, we'll call you back. No one called me back. No one called you back. I keep doing it every day. I've done it maybe 3 times a day. For last 10 days, I was so upset last 10 days. Even the health department, she said, I'm sorry, we're in big mess, too much people, not enough people working, you know? She said, I'm so sorry.
Rana says they were only cleared after she called her local state MP.
Even the police, after I was released, they came 3 times, knock on my house. I said, hold on, I'm released, look the paper. Oh, sorry, your name's still on the system.
Obviously the system is overloaded. With them trying to keep on top of all the new contacts arising and all the new cases is taking up their time, I imagine. But there does need to be a better system for letting people go.
Rana says she's not the only one who's been left waiting to get the all clear.
I got one friend, she was 21 days and no one called her. And she was begging to have this letter, begging.
In a statement to 7:30, the New South Wales Health Department acknowledged unintended delays to inform some COVID patients about their release from isolation and apologised to those affected. Former New South Wales health worker Rima El Hassan has taken the step of engaging lawyers to represent people who've been left waiting in isolation.
Just because these people need to go to work, they need to provide for their families, they need to seek medical treatment.
Over the past 6 weeks, she claims to have heard dozens of similar stories.
Many of these households that we've spoken to are single parent households. Many are refugees. Even someone like myself who's very privileged and literate and possesses great health literacy skills and resources, I even found it a challenge to actually make contact with these local health units.
With more than 13,000 active cases in New South Wales and even more people isolating at home as close contacts, state authorities are clearly stretched to the limit. But with cases expected to peak as the states reopen, some are questioning whether the direct individual clearance system can be maintained.
As the numbers increase and as the vaccination increases as well, then we won't need to as rigorously use quarantine for the contacts of cases. Singapore, South Korea, which was an early starter in all this area, provided a lot of support for people in isolation with twice-day visits, which were about supporting the people, but also obviously checking that they were still at home. But we can do that with technologies such as, ankle bracelets, heaven forbid, or other app technologies to ensure that people are at home, that sort of thing.
Epidemiologist Professor Tony Blakely says quarantine requirements will likely change over the next 6 months and possibly ease some of the strain of contact tracers.
If they're a close contact, you would still want to have them in quarantine for some period of time yet. But if they happen to be somebody who just went to the same supermarket where that other person was visiting in the last hour, or they were a child at a school where somebody in another classroom was infected, we're going to not feel the need and not need to put all these people into quarantine because we'll have high vaccination coverage.
Put your bike there.
But for Rana, the experience has shaken her faith in a health system facing one of its biggest tests.
We're all good families. It's very upsetting to see that happening to us. Very upset. Destroying.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.